Recently, a carnivore influencer named Dr. Kiltz came out and said he may not be carnivore anymore. And I'm not here to talk about rumors or to start drama. I'm going through this video that he's talking about and why he's doing this. So we're going to dive into it right away.
All right, Dr. Kiltz here. And I've been Mr. Crazy Carnivore for nearly 15 years. I felt amazing. And some recent things happening all over the world and in my life personally. We've seen some people leave us in this world and maybe in a very polarizing way, potentially. And I've been thinking a little bit more how the shining light of faith in the highest power within all of us needs to be a positive light to bring people together. And leading as a carnivore and only eating meat maybe was a little too polarizing.
So we're going to stop there first. So first things first, I love his honesty and humor, calling himself a crazy carnivore for the last 15 years. I appreciate the honesty saying like, hey, this is who I've been. This has been my identity. And he kind of talks about this polarization, right? And he's saying, we've been pretty polarized. And I agree, like we are way too polarized in a online health community. I see it all the time. Like I know if I mention something in a video of mine, like the people in that community will come and they will show up in force. That's just like how it goes and what happens. But we are very, very rigid in our thinking as humans. I'm not saying I'm immune to this by any means, but we've become so polarized that we can't even listen to other people having conversations about things that we don't necessarily agree with. And unfortunately, a lot of times these groups online embrace this as a badge of honor. Like, hey, we are different. We are anti-mainstream. We love that. And that's like an identity. So it's really hard when you're wrapped up in identity. Like when your identity is wrapped up in anything, it's hard to break free from that. But I can just say, right from the start of this, you hear this music, it's somber music. He's talking about doing a lot of things. He's talking about higher power. Like this dude is thinking about a lot of things and like my heart goes out to him. So like this whole video is not an attack. I've seen attacks on this video saying, oh, look at this crazy carnivore changes his mind. It's like, that's not what this is a guy, right? This is a dude, a human being who has emotions and fears and probably a family and like all these things. So I always want to say like this, my heart goes out to anybody who's going through a tough time, and clearly he is. And so that's one thing I just want to mention. I'm not here to pile on. I'm here to listen and offer perspective. That's essentially what it is.
And recently I've also had a test that showed my CAC score went from 700 to 800, and my CT angiogram noted a few more plaque sites with calcium in my LAD, in my right coronary artery, and in my circumflex, although my heart function and my blood flow is excellent. I feel great. I recently suffered from some acute colitis. I don't know what it was, but I did some fasting. I did some ivermectin and I did some flagyl. I've recently started consuming.
Ooh, and we're going to hold it right there. But so he is breaking into a couple things. So first he's saying, I'm feeling good, right? My heart is pumping fine. The blood flow is good. I feel great. And this is one of those things where when I see this, my initial thought is, that doesn't give me a lot of comfort. And so he's saying, yeah, the pump is working fine. I'm sure his ejection fraction, if he got an echocardiogram, was fine. And that's great. And that's why, he feels everything's fine. But just because something feels fine doesn't mean there's not an issue there, right? So we can think about maybe the heart, and we talk about pumps and fuel lines essentially. So the engine is like the pump, right? So we have to have the pump, and the fuel lines are the arteries. So like your heart could be pumping fine, but like the fuel lines to get there could be garbage, and everything's fine until it isn't, potentially. And so hemodynamics, which is kind of how blood flows, that's definitely a lagging indicator of atherosclerotic cardiovascular disease. So relying on them can be dangerous because sometimes the first warning sign is having a heart attack. A lot of times the first sign of a heart attack is actually having it. Some people do have something called angina, which is when you have chest pain with exertion. That's indicating we're not getting enough oxygen to our heart tissue. And a lot of people do have that before, and they have, 98% blockages or something like that. But a lot of people, unfortunately, the first symptom they have is actually having a heart attack. So saying I feel good, that doesn't necessarily make me feel good. And another reason we can do that is because our body is incredible, right? We can have adaptive responses to it. So our body knows this, has plaque, can respond to it. If you look at the slide here, we have a normal artery that has normal flow going through something called the lumen. The lumen is the opening of the blood vessel. When you start to get heart disease or atherosclerosis, it kind of goes into the wall of that artery and it actually pushes the wall and the artery out. So it doesn't necessarily impinge on the actual opening right away. It kind of builds into the wall. So you can have build until it's too late. So for analogy, imagine a road with a construction site on the side, right? So instead of blocking traffic, the body kind of widens the road out. So it pushes that construction zone outward and not through the actual lanes. The outer wall expands to hide the plaque, keeping the lanes open. So it's open, right? So traffic is flowing, everything's fine, it's moving great, everything's fine. But until what happens is eventually it's not this traffic jam, it is a big accident that happens. So essentially you can have the construction site or the plaque ruptures, leading to your body to cause a clot instantly, or that clot can break off, go further down the heart into a smaller vessel and block that and cause a heart attack. And so feeling good now is just a flow issue, right? It's going fine. That's why we're having it. But it doesn't necessarily mean we are in a healthy situation. And on top of that, he mentioned his colitis, right? He said, hey, I got colitis. I'm feeling bad. And he took flagyl, which is antibiotic, and he also took ivermectin as well, which who knows what the reason we're treating him for. I'm not his doctor, but enough where we have to take something is concerning, right? And one of the big issues people talk about with carnivore is, hey, we're not having any fiber. And is that bad? Is that problematic, right? So with fiber, we tend to think it adds to the good microbiome in our gut. And so either way, what I see is someone who has been doing something he thought was right. And now all of a sudden he's getting screamed at by two directions, his heart and his gut. And it's kind of the moment that like this invincible armor is starting to crack is what it appears like to me. But once again, my heart just goes out to this guy. Like this is a very vulnerable spot to be in. I respect him tremendously for doing that, but it's very painful to see like, hey, when you don't have control of your body, it's a scary thing, right? Anybody's ever been there, ever been sick or had something wrong with them? It's a very, very scary position to be in. And so I respect his vulnerability, but you can kind of see, hey, this is where it's going. So he did mention something I want to talk about, and I don't want this to be just a reaction video. I want to do a little teaching as well. So we talked about CAC and coronary CT. We talk about both of those. So first, CAC, what does it stand for? Coronary artery calcium. And it is looking for, you guessed it, calcium in the coronary arteries. It's a non-invasive test. It's quick. There's no needles or contrast, and the radiation is pretty darn low. Some people say it's like a mammogram for your heart, although that's not the same case at all. But the screening idea is what they're going for, saying, hey, it's a quick, low radiation screening. And the target those for people who are of kind of intermediate risk. So it's looking for this calcified plaque. The calcium in your artery indicates that, yes, you have plaque. Guaranteed. It's kind of looking for where we have that, but we think that the calcium is a little more solidified and more stable, but it's looking for these lesions to tell you, hey, do you or do you not have heart disease? And once again, I mentioned it's kind of this intermediate risk. So people who are in this intermediate risk, you can use different risk calculators to kind of determine that based on cholesterol, blood pressure, all these different things. It kind of helps us decide where do we go from here, right? So if a patient's unsure about starting a lipid lowering medication or aspirin or something like that, this can kind of be the tiebreaker, right? So if you go in there, you get it and you have a bunch of calcium, says, hey, you're actually a higher risk than we thought. Or if it's completely clear, then you say, oh, maybe, we can decide to just do lifestyle or whatnot like that. So this is generally actually recommended if we're kind of on the fence, like, oh, I'm not sure, we can kind of look at that. And how do we look at it? Well, we can look at the scores. It is measured and given kind of something called a Gadsden units. And this calculates the total area and density of the calcium. And so there's different buckets. We have very low, low, moderate, and high risk. So first of all, very, very low is 0. So 0 means no calcified plaque that we can see. Congratulations. You're at a very low risk of having an event in the next 5 to 10 years. And that's something worth mentioning. These scans are good for a very short-term prognosis, meaning like, hey, I can only talk about the next 5 to maybe 10 years. It's nothing longer than that, but that's the general time frame we talk about here. And so here, this often, if it's 0, kind of a lot of times don't need to start a medication. We can say, hey, let's focus on lifestyle and go from there. Then you have mild, which is 1 in 99, meaning you definitely have plaque and your risk is elevated compared to 0. So here we kind of decide, oh, how would it feel? Do we start something? Do we not? But that's where we are. Then we have moderate. Moderate is 100 to 399, meaning you have a pretty high risk of future events. Usually recommended to start some sort of lipid lowering therapy or aspirin or something like that. And maybe consider all the things you have to talk. Aspirin's kind of goes back and forth every other year. And then we have a severe score, which is greater than 400, meaning you have extensive plaque burden and the patient carries a significant risk for developing some sort of issue down the line, right? So yeah, that's where we're at. And just to put in context, in this article, Dr. Kiltz mentioned his CAC score went from a 700 to 800. So he's 800. So he is definitively in the high risk zone. So that's like the big thing that I take from this is obviously he knew he had it before, but it's gotten worse. So that's a big thing. And as I mentioned before, CACs are helpful, but they're not perfect. So the big blind spot is a CAC cannot see soft, non-calcified plaques in the artery. So, and we think of those are the most unstable ones, right? So these unstable fatty plaques are the most prone to rupture and cause heart attacks. So we can't see that. And so although it's rare, it's possible to have a CAC score of 0, but still have a dangerous soft plaque. As we saw in the video, he has a known plaque from this and a coronary CT, which we've talked about as well. It doesn't show you, like, this score does not show you how much you have, how much of blockage is there, anything like that. So that's something we have to keep in mind when getting a CAC score. And then the other side of that, he also mentioned the coronary artery CT. So this is a different test. This is kind of the next level. It's kind of how I think about it. This is, if you got a CAC, this is like the next one, and is unlike the CAC score. This involves injection of some sort of contrast in you, so it's a more involved procedure. But it does show us what is actually going on inside of our arteries, right? So it illustrates the lumen or the inside of the pipe of the vessel of the wall. It allows us to see the soft, non-calcified plaque and the active cholesterol buildup, essentially is what it's coming down to. And as we talked about before with Dr. Kiltz, he explained that, he had a high calcium score, and also he has several lesions and soft plaques in this coronary CT. And so that's helpful. And why would we use this? Well, it can be very helpful for a bunch of different reasons, right? So if the CT says that your arteries are clear, there's a pretty darn high chance that you do not have obstructive coronary artery disease. And we feel good about this. So we use this for patients who are worried about this. We use it for symptomatic patients to see how far they are. We look for people who are high risk, who are asymptomatic. So lots of different reasons. But overall, there's different ways to grade them. That's kind of beyond necessarily the scope here. But it kind of judges your overall plaque burden. It lets you see like, hey, where are they? How big are they? How much are they? So it's a next step up, which can be helpful. And then we saw here with him, he was also pretty high. So big things that we worry about. Obviously, I'm not super excited about that, but let's move on to the next one.
Cod liver oil, molecular fertility, ubiquinol, along with a little bit of iodine and baby aspirin. I'm still on my typically one meal a day. I've thrown in a little bit of energy bits, algae. I've also incorporated fish, salmon. And the whole idea is that could it be that maybe my consumption of only red meat may have contributed? I don't know.
All right, so we're going to stop right there. So first and foremost, he's saying that, is it possible that his beef-only diet caused this? He doesn't know. At the end of the day, it doesn't matter. Like, people will speculate and say things, but like, it doesn't matter because he is where he is, and I respect that. Like, hey, we don't know. Is eating a high saturated fat diet probably contributing to this? The answer is probably yes. But I really want to talk about the things he's using, right? So he's talking about, hey, I'm trying these things. Well, why is he saying he's trying all these things? So I just want to at least mention that here. So first and foremost, he talked about his eating fish, right? And omega oil and algae and all that stuff. So he's eating all those different fish. He'll talk about it a little more later. But what that happens is they are full of the good fats, right? So EPA, DHA, and they've been proven to potentially thicken the fibrous cap on atherosclerotic plaques. And so make that more stable, to have less likely to have a rupture. That's the goal. Also, it decreases inflammation. They are precursors to a molecule called resolvins, and they don't just block inflammation, they actively help decrease that and clear out inflammatory cells from the artery wall. So we're kind of hoping that, hey, it's helping there. And on top of that, omega-3s, specifically from fish or algae, they lower triglycerides, can raise HDL, which we talk about as generally a helpful marker. And on top of that, it also provides for cell fluidity in the wall and all these things. So it can do a lot of things. And so we've had data and we've looked at trials, things like the Reduce It trial show that high dose EPA reduced cardiovascular events by 25% in high risk patients. And so this is overall just like a general, like, yeah, this seems to make sense, might be worthwhile. Then he talks about ubiquinol. He's taking it essentially, that is the antioxidant form of coenzyme Q10. So that's what ubiquinol kind of is. And what does it do? Well, the heart requires a massive amount of ATP, and ubiquinol is essential for the electron transport chain in the mitochondria to produce energy. On top of that, it increases the bioavailability of nitric oxide, which allows blood vessels to relax and dilate, which reduces arterial stiffness. And also it's a potential antioxidant. So the idea is that if it's antioxidant, it means less LDL is going to oxidize, which is what makes the artery, the plaque, worse. So that's why he's taking it overall, saying, hey, that's what he's going for, to try to do all those things. He mentions iodine as well. This one's not as well studied for this specifically. We do know that thyroid hormones control the liver's expression of LDL receptors. And if you're iodine deficient, thyroid function drops, LDL receptors decrease, and cholesterol stays in the blood a little longer. That might be the reason behind that. So yeah, but we have seen that might be a reason for it. Also, something called reverse cholesterol transport. Iodine supplementation is deficient in deficient individuals, has been shown to decrease total cholesterol and increase the catabolism and breakdown of LDL. And once again, as I mentioned, iodine may be in antioxidants as well. So he's taking it to make sure that things are optimized from that perspective. And then he talks about baby aspirin, which baby aspirin's like every other week, there's recommendations saying we should do it, we should not do it. The idea behind it is it's going to thin your blood a little bit, right? So it prevents platelets from clumping together to form a clot. That's usually the first step of a thrombus, is platelet aggregation. And so by being on a baby aspirin, it kind of thins your blood a little bit, so we have less likely chance of that. That is a pretty standard medication now for secondary prevention. So if you've already had a disease or a heart attack, but if you have extensive coronary disease, the question is, do we not? A lot of people will start on a baby aspirin. So that's kind of been his new stack there. Those are the kind of the big things he was talking about, why he's taking those things, which can be helpful. And he's kind of mentioned, hey, I'm taking more fish now. And that seems to be a general recommendation in a health promoting diet, is like including fish. Seems to be like a generally accepted thing by most dietary patterns. Obviously not necessarily veganism, but like that's the only extreme where otherwise like people say fatty fish specifically are very good. And so that's something else he's looking at. So let's see what he talks about next.
I love beef, but maybe my focus on only beef and carnivore is not going in the right direction completely. Maybe being a little bit softer and inclusive That's what I'm working on. I'm not ready for broccoli, but baked potato with a lot of sour cream and butter, yeah. But I'm going to say, hey, listen, if you throw in a little bit of broccoli or asparagus in that, that's okay. I say.
So that's a big change of pace, right? So first of all, I just once again applaud his vulnerability. It's hard to be going from carnivore's king is everything to publicly question the foundation of his entire framework, right? So that's a big thing. And I respect the pursuit of health over, a whatever you once believed. I think that's really cool. And at the end of the day, when your personal data says stop or don't do something or it's not working, you have to be willing to listen, even if it hurts your brand or beliefs. And I know it's much easier to say than to do, right? If we all caught up in thing. And so, he said, that's kind of where he's at and thinking about being more inclusive. And yeah, I really do respect that. And the one thing though, he did mention is like, hey, adding in foods, it's great, but it's probably not enough, right? He's so close to finding this balance, right? So he's just getting there. And so I would never say like, oh, like he needs to do more. Like he's going to get to where he needs to get. I think just based on what he's listened to, he's open now, right? So he's saying, hey, you can add these things, you can do potatoes, but with lots of butter and veggies with lots of butter. And so like, we're starting to get things in, but the question is, was it all beef and was it not having the other foods, or was it having high saturated fat diet? I mean, I think there's pretty good evidence that high saturated fat with existing plaques leads to more plaque. And so it's one of those things where he's very, very close to making that change, but he's just not quite ready. He admitted that, right? He said like, yeah, I'm not quite there, not quite ready. And once again, to change it's a whole process of change. If you ever work with a patient or anybody, like trying to change, there's different levels to this, right? So it's going to take quite a bit of time. And yeah, that's something I want to mention, that he's getting there, inching there. And yeah, I just want to mention that.
Cook it well and add the fat, butter. I've been using a little bit of Miller's Biofarm raw cream, raw butter. Again, it is softening the message. It's inclusive. It's shining the light of positivity. So again, we all need to be open to change. Kiltz is open to change. To me, it's paleo keto carnivore. Faith first, number one. I always say 1 meal a day. Eat the fatty meat. Again, whether it's fish, chicken, turkey, iguana, alligator. I think we need to be softer and shine the light and more positive and limit the polarization. So check out drkiltz.com, Kiltz Mighty Tribe. It's all for free. We have some add-ons in that, and the university, Kiltz Health University, for all of us in order to continue on this life of learning every day. God bless.
All right. So that's the end of his video. And so there's a lot to take in there towards the end. Clearly, he's saying a lot of different things and trying to find common ground and go from there. And so this is going to be my take-home thoughts here. So at the end of the day, I'm not his doctor, right? I'm not your doctor. I'm just some dude on the internet. So don't listen to me. But if this were a patient of mine, who I've seen multiple patients like this, who they have cardiovascular disease known and are doing a keto diet, I see them through my residence or whatnot. What would I talk about? Well, I'd say overall, I think we can do a little more. It was what I would probably, gently say that. Obviously, you have to talk to someone. You say, hey, like, where are they at? Are they at change? He clearly is in the pre-contemplative stage, or actually in he's actually making changes, but like to completely flop, he's not ready to do that yet. And that's fine. You got to meet a patient where they're at. But I would say at this stage, aggressive lipid lowering is probably the safest thing to do in the interim, right? So we know that just making some little lifestyle changes and whatnot there probably is not going to be enough when we've already had a demonstrated CAC of 800 with soft plaque. So we know we have that there. The general guidelines are to get LDL less than 55 or ApoB less than 60 generally. And this is, as far as I know in the research I've done, the most reliable way to stabilize or regress plaque. So reversing plaque is like the holy grail, right? Everyone talks about that. And what I've seen consistently is that when you're getting very, very, very low, that seems to stop plaque progression or can potentially reverse it. That seems to be the best way. Are there other ways? You'll find studies here and there showing that yes, but this is like one of those like surefire, hey, if you have no fuel for the fire, you can't have the fire. And people will talk about, is it healthy getting that low? At the end of the day, like we can have those conversations for an otherwise healthy person, like for preventative, like, hey, like, is it helpful? Like that's a whole other discussion. But for someone with known pretty severe atherosclerosis, lowering that down and giving that fuel, like giving no substrate for that fire, that's going to be the best way of doing that. And at the end of the day, I would tell a patient like, hey, this isn't cheating. This is not losing. We're not doing that. It's about staying alive, right? So we have tons of tools to do this. Obviously, We have statins. Everyone talks about statins, but we have ezetimibe, we have PCSK9 inhibitors, we have bempedoic acid, we have lots and lots of things and more coming out each day. And I understand people will be like, oh, and typically if you're in the lower carbohydrate tribe, you'd say like, no, like it's LDL is not the issue. But all I'm saying is we are seeing progression in the current way he's eating, and currently what we're doing is not working. And so one thing I like to talk about here specifically, and when I see patients like this, is say, hey, in the low carb world, they've been coming out with their own research and I love that they're inquisitive. There's been a big keto CTA study came out in 2024, looking at, what causes heart disease. And their biggest outcome that they talked about was that plaque was the number one risk factor for progression on a keto diet, right? So ketosis is not a shield. It doesn't protect you by any means. And so despite the numerous problems that were with that paper, it's direct evidence from the low carb community that a low carb diet in the setting of plaque is probably not a great idea, right? So all the people in the world, who are in this community, they saw this, and the idea of what they took from it was that, hey, ApoB doesn't necessarily line up to it. Once again, we won't talk about that thing, but it was indisputable that plaque leads to more plaque. And so even in a keto environment, right? That's the big thing. A lot of people say that, hey, if I'm carnivore or keto or whatever, I have my insulin sensitivity is so great, I can't get heart disease. Well, all that goes out the window when you already have heart disease, right? So those are discussions for other days. But yeah, that's the big thing I want to talk about. And I would say, hey, this person, I'd sit him down, I'd say, all the people in the world who are part of this community, right? Your online community, whatever, your friends who are keto or carnivore, like the vast majority of them don't care about you personally, right? You need to make a decision for you, your family, and nobody else. That's it, 100%. In fact, I can see comments on his video of people pretty much like saying, oh, like it's not the beef. It must be something. It must be this, must be that. It can't be the diet. It has to be this. And like, I see that all the time, like pretty much blaming him, saying it's something you've done and it can't be the diet's fault. Well, guess what? The way he followed the diet is the way he was following the diet. So like clearly whatever he was doing wasn't working. And so that being said, I understand this. Any change in a belief system is really hard, right? With or without evidence, right? You could smack someone across the face with evidence, and if it's ingrained to them, it's going to be very hard. And this is me too as well. I completely recognize this, but I'm just trying to be a voice where, hey, on the internet, you say, oh, I've been thinking this. Could I be wrong? Could I be wrong, right? And that's like the question I want people to ask all the time. There's going to be a pebble in someone's shoe. So as you're walking thinking, oh man, like what did Jordan say? I can't remember that. But once again, if someone has their identity, partially wrapped up in a dietary intervention, and I'm not saying he does necessarily, but in general, it's hard and it's going to take time to walk that back and potentially change. It's going to be really hard. So maybe he will, maybe he won't. Regardless, I want to say that if he ever sees this, that I want what's best for him. And that's at the end of the day, I want what's best for him, for his family, for his followers, for patients, but I just want him, to do well and have a good outcome. That's really all I care about. I don't care about being right. I just want to provide a perspective. Like, is it possible that we were wrong and they're right? Like, yeah, that's totally possible. But either way, you got to kind of look at it. I do respect his priorities, right? He says faith first. Health isn't his only idol, which is wonderful. And at the end of the day, you are the expert to your life. He's the expert in his life. I'm just a person making some comments on the internet, right? I'm just one beggar to another beggar telling you where to find food potentially. But that's going to be it for today. If you enjoyed this video, thanks so much for stopping. I appreciate it. It'd mean the world if you share this with a friend. But get off your phone, get outside, have a great rest of your day. We'll see you next time.